Thanks for jumping on. My name is Charlie Chividgen. If I don't know you or haven't had the pleasure of meeting you, I'm the founder and CEO of Every Mother's Advocate. And today we have with us Jared Walker, who is the founder of DollarFor. So we're really excited for you guys to join this morning. We're talking about medical crisis, medical debt, how it affects the moms that we serve, especially communities of color, those who are disenfranchised, marginalized, poor, and from minority communities, and how this issue and crisis affects them. But the good news is today we're going to learn about a really easy solution to it, something that's accessible to all of you, something that's accessible to the moms that you serve, and a really valuable tool that you guys can use going forward. Really quick, Jared Walker is the founder of DollarFor. He founded this nonprofit organization in 2012 out of Portland, Oregon. If you haven't visited Portland, go ahead and put that on your bucket list. DollarFor was born out of a desire to help folks in medical crisis after watching his own family's experience. A medical crisis should not lead to a financial crisis. Jared is on a mission to crush as many medical bills as he can while making charity care known, easy, and fair. So we're really excited to have you with us today, Jared. Welcome. Thanks for joining us.
Thanks for having me.
Really quick, tell us the background. Why did you start DollarFor?
Yeah, so I started DollarFor. I first had the idea for DollarFor in 2012. My wife and I were sitting at home. She got a phone call. Her aunt had passed away from cancer. And then like 15 minutes later, I got a phone call, and my cousin had gone into labor 7 weeks premature. Baby needed a heart surgery to live. And both families were kind of hit with these medical crises at the same time, same day. And I just remember the number one conversation was how are we going to pay for it? So I was super frustrated. It was kind of like my first run-in with the healthcare system, and just realizing that is the story for most people in America. Instead of focusing on their health, it is, what are we going to do? How are we going to pay for it? So I wanted to help people in that situation, hopefully relieve the financial burden that comes with the medical crisis. But at the time, I started, crowdfunding to help people pay medical bills in Portland, Oregon. So started this little community organization. And then over the years, I came across a law in the Affordable Care Act that requires nonprofit hospitals to have charity care. And I felt like an idiot because I had been paying medical bills for low-income families that all would have been eligible for free or reduced care if I would have known about these programs. So, which we can get into, but that's the kind of the origin story. Officially launched DollarFor in 2015, and then kind of shifted from the crowdfunding model to the patient advocacy model in 2019.
And I think something about DollarFor that resonates with so many people is that all of us either have experienced this firsthand, or we know somebody that has experienced this firsthand, of an extreme medical crisis that is already so, wearing on a family when you're having to navigate through that. And then you get slammed, like you said, with these financial bills. I think what we forget to recognize sometimes, though, as we live in our own worlds, is how this affects families who are in poverty and living below that poverty line, which I was looking up some data recently of what 2021's most recent federal poverty line is. And for a family of 3, it's $21,000, which is nothing, right? And so you start to imagine like how something like this, how a medical crisis impacts families that we serve who are all living at near below that federal poverty line. And there's some misconceptions around that in and of itself, that like everybody who's living below the federal poverty line has access to Medicaid. And so I do want to jump into some of those misconceptions in a little bit. But at EMA, we serve low-income moms, many of them, if the vast majority, are single moms, so they're raising kids alone. they are already especially sensitive to these, what we say, even nominal increases in medical out-of-pocket expenses. Co-payments have an effect on reducing access to necessary medical care, medical debt, medical fees, premiums, co-payments. All these things contribute to a financial burden for a mom who is living below the poverty line with small kids, who, for those of us on the call that are moms or have kids or care for young children, we know how expensive kids are. And so what happens is that problem becomes so pronounced for families who are living at what we identify as some of the deepest levels of poverty, even in a first world country, and have no money to pay for these medical debt and have no, idea of where to access this type of medical relief. Because as you know, you started DollarFor with almost the wrong solution and then found a better one, because some of those solutions are so hidden. So we want to jump into, we identify that medical care and medical debt is this astronomical problem for the families that we serve. And then it also keeps moms and children away from accessing medical care that they need because of this fear of this financial burden that it's going to now have on their family. And then by the time they do get medical care, it's too late. So let's start at the top. Is it hard for people living below that poverty line to get quality health care? And if the answer is yes, why?
Yeah, I think you touched on a lot of it. I think that, we know that I think it's one in three Americans will just neglect care
Mhm.
because of fear of the bills. So you have people that, yeah, put off simple things that should, preventative care and all that. We do a terrible job of that in America. So then when
Mhm.
something does happen, it is so much worse. And yeah, the idea that, oh, all these people are just covered under Medicaid, and then there's, at least in Oregon and Washington, I think the Medicaid cutoff is like 140%, or maybe it's like 138% of the federal poverty guidelines,
Wow.
which is it's like, $17,000 a year for a single person. So if you there's a
Mhm.
gap between, and I need to kind of get into charity care and what that is, but there's a lot of people that make just a little too much money to qualify for
Mm.
Medicaid, but would still be eligible for free or reduced care through these other programs. They just have no idea that they exist, and then
Exists.
hospitals make it impossible to access.
Yeah. Do you believe our current healthcare system is set up for those who are poor, marginalized, disenfranchised? Do you think it's set up for those communities to succeed within the healthcare system?
I think you know the answer to
I
that. No, I think
think it's a
that
leading question.
yeah, no, it's such a it's so frustrating. I feel like I have people all the time that are like, "Oh my gosh, I have
Mhm.
a master's degree, and I got these medical bills, and I was so confused. How on earth does anybody navigate anything like this?" And it's just like
Mhm.
that it is what it is. Like, um, you go to the hospital, and you get a hospital bill, but then you get six other bills from all the other providers. Like, why isn't it in one bill? You get seven
Mhm.
different bills from all the different providers, and then trying to find, uh, you know, and so many times we hear people that are just like, I paid my medical bill, and now I was just sent to collection for this other bill that I didn't even know about because they were
Mhm.
sending the bill to the wrong address. Or it's just like, um, this is super super confusing and frustrating for everyone. And if you don't, and then you know most of the hospitals, like when we get into more
Mhm.
deep into financial assistance and charity care, like most of these hospitals are going to require you to uh, to fax in your application, and
Mhm.
it's like it's just not accessible for anybody. So it is
Yeah,
definitely not set up uh,
for these
for
families to
patients
succeed.
for
Yeah,
sure.
because it's so complex, it's so complicated, and even the most competent and well-resourced person has a hard time navigating these systems, let alone families who have a million other compounding crises and issues to now have this one added on top of it. You kind of touched on this already, and then I want you to go into just DollarFor, who you are, what you do, and we'll go into the debt forgiveness program. What do you think is one of the hardest things that families in poverty, specifically moms who are poor, who are low income, have to deal with when it comes to navigating medical debt and medical crisis?
Yeah, I think so. It's like you get a medical bill. Why do you get a medical bill? Because you just had some type of medical crisis. You have other things on your mind. So then, I
Mhm.
mean, that's like the biggest thing that we hear all the time. It's not even so much like, oh, you helped me get my bill waived. Like that's all
Mhm.
obviously important, but it's like someone was in my corner. Like that
Mhm.
is like you need an advocate. I
Mhm.
see your social media posts all the time. Like you just need an advocate, someone to help you navigate through this. Because again, this is pretty much hard for everybody. And then you
Mhm.
add all the other layers of like, okay, you are struggling with whatever medical crisis you have. You're a single mom. English is your second language. Like all
Mhm.
of the different barriers, and it just gets so overwhelming. So then you get what we see all the time is people will panic, throw it all on a credit card, and then that
Mhm.
leads to like it starts to spiral, or your credit is ruined. So you're not able to get a loan, you can't get a car, you don't have
Mhm.
reliable transportation, you can't hold a job. Like all of these different things start happening because of medical debt, which is a debt that is like unavoidable,
Mhm.
which is super frustrating. So yeah, it really and yeah, and then you get into the housing. Like there's so many different things that medical debt just kind of impacts it all and makes
Right.
it all worse.
Right. Yeah, because at EMA, we work with moms who feel this way in all of their systems. And so
Mhm.
what's cool about DollarFor is that this is a really easy way to solve this particular crisis because they feel it in the legal system. They feel it when they're in court. They feel it when they're searching for housing. They feel it when they're hunting for jobs, that all of these systems are broken and hard to navigate. And so what DollarFor brings to the table is this really easy solution. So Jared, tell us a little bit about DollarFor and just like from a high level, what you guys do and how you do it. And then we'll jump into the debt forgiveness program.
Yeah. So when uh, when I discovered what charity care was in 2018 or 19, again, I was crowdfunding to help people pay bills, and basically, this is like the best kept secret of the Affordable Care Act. So if you don't know, financial assistance charity care, most hospitals in America are nonprofits. I think it's like 65%. Um, and in order for these nonprofit hospitals to keep their nonprofit status, they have to have charity care, which is basically their way of showing the IRS that they are providing enough community benefit to justify the status. So
Mhm.
if you are within a certain income range, the hospitals will waive your medical bills. They have to. So people don't know this. So millions and millions of people are declaring bankruptcy or on payment plans for medical bills that they do not have to pay,
Mhm.
which is incredibly frustrating. So, and you've mentioned the poverty level.
Mhm.
These charity care programs go well beyond that most of the time. So,
Mhm.
like here in the Pacific Northwest, every hospital is required to waive 100% of your medical bills if you are at or below 300%
Mm.
federal poverty guidelines. Um, Oregon, Washington, California are pretty much all the same. So you have these resources that are available. There's a law that says, hey, you have to have these. You have to have the policy on your website. You have to do this, and the hospitals will do like bare minimum to keep their status. But it's been proven time and time again that the nonprofit hospitals are benefiting so much more from their nonprofit status than what they're giving back to the communities.
Mm.
So you have like this huge gap in the amount of charity care that should be being let out to the community,
Yeah.
that is not. And so, yeah, it is, to me, this is like the lowest hanging fruit to help patients right now. Um,
Mhm.
we just hit $20 million of medical debt relief, um, helping patients all over the country. So, like, it works. I know it almost sounds too good
Yeah.
to be true. Like, oh, hospitals will waive your medical bills if you fill out these paperwork. Um,
Right.
but it works, and we do it every day. So um, yeah,
$20
that's
million in medical debt relief. And this is across the country?
Yeah, so I believe we've eliminated medical bills in every state, um, and some states, you know, how do I say this? Some states are better than others. Like if you are in Washington State, we have so there's like this federal law that
Hmm.
requires hospitals to have these policies. It's pretty loose though. It's like you have to have these policies.
Hmm.
The hospitals choose how generous these policies are.
Got it.
There are some like minimums, like hospitals have to give you 240 days to fill out the paperwork. It has to be at least at 100% of the federal poverty guidelines, but most hospitals go well beyond
Hmm.
the minimums. Um, and then, on the back of your bill, you might have, hey, if you have a hard time paying this medical bill, call this number. That
Hmm.
number should go to the financial assistance department. They should but what happens is if you call that number, they're usually going to put you on a payment plan. So like
Mm.
hospital staff is actually trained to kind of sidestep the financial assistance thing unless you ask for it, a certain amount of times, whatever. So it is, yeah, it is very hard to access.
Yeah.
They don't make it easy, but it is there. And then we as an organization, we do this for patients free of charge. So we fill out all the paperwork. We submit it to the hospital through fax most of the time, which is
Yeah.
what I mentioned earlier. We have an eligibility screener, so a patient can quickly see if they're eligible at their hospital. We've collected the data from every hospital in the country, so a patient can go to our website, put in their household size, income, what hospital it will tell them what they're eligible for, and then we fill out all the necessary paperwork, submit it to the hospital, and then do all the follow up. Call the hospital, advocate on their behalf, and then
Hmm.
if they would like, they can do like we have like an education hub on our website if they want to try and tackle it themselves, because sometimes there is
Hmm.
some sensitive information like proof of income and stuff like that. If patients just want to try it themselves, we have uh, phone service, so you can call in, talk to a patient advocate, ask questions, and then we also have a text support as well. So we
That's
can answer
incredible.
questions along the way. I see this question: what's the name of the law? So if you really want to like nerd out on this, it's in the Affordable Care Act, but it is Section 501R, and I believe it's 501R4 is the specific charity care. Um, you can also go through if you really want to get into it. There is 990s. So hospitals are required, all these nonprofits have to fill out these 990s. If you look up Schedule H, hospitals should be completing a Schedule H, which defines their financial assistance program.
Hmm.
Um, a lot of them don't do it,
Yeah.
which is really annoying, but that's another resource to find what hospitals are. But you can also, well, I'll go over that later. So
Okay. Well, we can jump into, if you want to share screen, Jared, and show us how we can access this. What's cool about it is such a beast to tackle. And so what's cool about DollarFor is that they have patient advocates that are literally going to do it for you. Like he said, you can do it yourself if you have a client that wants to just keep some of her information a little more private, which we can ask questions about that in a second. But the DollarFor does it for their patients for free. So do you have access to share screen, Jared?
yes, and I'm going to just drop a couple links. So dollarfor.org/help is our eligibility screener. That is where you can see if you are eligible for a program at your hospital. Another thing that is really helpful is just like knowing what to look for and how this all works. So somebody drop a hospital in the chat. What is a hospital that is in your area? Um,
Hospital in your area, any St. Mary's,
St. Mary's. Okay.
JFK Medical. Oh
St.
my
Mary's
gosh, so
in
many,
what
so many.
state? Yeah, here we go. Uh, guess how many St. Mary's hospitals there are in the United States? There's a lot.
Thousand.
Seriously, there's a lot of them. Okay, I'm gonna do Jackson,
JFK Medical.
Holy Cross. I know Holy Cross. Okay, let's do it. Okay, so I'll look this up real quick. So here, dollarfor.org/help. This is This is where you go to see if, like, for quick eligibility screen, for us, if you want to go through it, through $4. This usually takes like 3 minutes, see if you qualify. So let's say you have a hospital bill and you put in some info here, Jared Walker. Here we go. Okay. So let's say I'll go to Florida. That's where y'all are at, I think, right?
Mhm.
Um, and oh man,
Is this county? Oh no, this is
yeah.
city.
I think
This would be
oh, city.
Fort Lauderdale.
Okay. So what hospitals we got? Florida Medical Center. So let's say I have a $5,000 bill from May of this year, and how many people are in the household? Let's say I'm a household of 3, and we make 40,000 a year. So you're gonna go continue. It's gonna ask you a couple demographic information, which is optional, and then you go see your results. So, oh, lovely. Okay, so this is the problem with Florida.
Oh.
So some of these hospitals, they they're not in compliance with the law,
Mhm.
unfortunately. So let me go to one real quick here. So if you have a medical bill at most hospitals, where am I going? Oops. Okay. So I'm just gonna go legacy, Salmon Creek, same thing. And so here we go. See if you're eligible. So here's your 2 options. So okay, you're found eligible, which I'm assuming most of the people that are going to go through this screener
Mhm.
are going to be eligible for these services. So then you can have full service. Again, both of these options are completely free. And if you want full service, you want us to fill it out, talk to a patient advocate, like get connected to someone on our team.
Mhm.
Lovely, go for it. If you want to try it yourself, click that, and then you will start to get emails and text messages and stuff like that. And we go from there. So there is some additional paperwork after this is
Mhm.
completed, but this is the gist of it. And all we're doing, like all that we are doing on our end, I'm going to stop the share and open another
Mhm.
uh, open another tab. And I'm just going to show you how we do this process. If I, oh wait, I'm not sharing, my bad. Okay, so I'm just gonna do NYU Langone Financial Assistance. If I Google that, you will see usually at the top. So this is how we created our database. So we've done
Mhm.
this with 5,000 hospitals. Um, we click on their financial assistance page, because if you go to the hospital's like home page, you're never going to find this info. You
Mhm.
have to like know exactly what you're looking for. So hospital name plus financial assistance, and then you can find the policy. So like on this page somewhere will be their financial assistance policy, you would hope.
Mhm.
um, Here we go, charity care and financial assistance policy. So then you get the lovely task of reading through this
This
document.
this is what your team does.
This is what we've done. So and I just like want to show people, like,
Mhm.
so for example, the hospital that I originally looked up, I forget, in Fort Lauderdale.
Mhm.
Um, there's a couple things that could be going on. One, they're a for-profit hospital. They're not a
Mhm.
nonprofit, which means most for-profits actually do have financial assistance policies. It's just that
Right.
there's not a law stating that they have to have one. So they don't have to have these on their websites. They might make you call a number, or they're a nonprofit that is just not compliant with the law, which
Mhm.
happens all the time. You would like to
Mhm.
think that it doesn't, but it does. And then here is the income. Like this is the policy for NYU. So
Got it.
you are eligible. I mean, this is actually I'm really familiar with this hospital because it's in New York. So
Mhm.
most of these they do like a community assessment, most of these hospitals, and then
Yep.
they find out what the income ranges should be for people that are eligible for free or reduced care. And it's based off like the average income.
Mhm.
So in New York, they are going to go up all the way up to 600% of the
Oh,
federal
wow.
poverty guideline because the cost of living in New York is so expensive. Where the hospital provides 100% discounts for patients up to 600%. So here are your income ranges. Like, as you know, a family like here, these must be monthly or no weekly. Holy cow,
Mhm.
weekly income. So that is their policy, and then that's like what goes into our eligibility screener. So
That
and
is
then there's a whole bunch
incredible.
of other things that uh, that go into this. So like residents, sometimes hospitals will put in stuff like, hey, if you're not from this state, we don't offer financial assistance. They
Mm.
might have stuff about insurance, uninsured, underinsured. Um, they might have stuff about, you know, asset requirements or whatever. But anyways, this
Mhm.
is kind of like a little extra, but just so you know, if you are
Mhm.
ever curious, like what is my hospital? Obviously, you can go through the screener, but really that's just going to say like yay or nay. Where
Mhm.
this is like you can actually have an understanding of your hospital's policy, like what is the income threshold here? What are the different criteria to be eligible?
Mhm.
Um, so, anyways, I
So
mean,
as far as eligibility goes, every hospital is a little bit different.
yes, unfortunately. So every single hospital has their own policy, their own
Mhm.
application, their own way of doing things. And there's nothing standardized about this process at all,
Mhm.
which is so annoying. So it is, yeah, you might have a hospital that goes, up to 600% of federal poverty guidelines. You might have a hospital that goes to 200%, 250. They might have, I mean, it is all over the place.
All
And
over
then
the
some
map, yeah.
hospitals just do like blatantly illegal stuff as well.
Yeah.
So like they'll have something on their requirement that says, you're not eligible for financial assistance unless your bill is $5,000 or more. So they'll have
Mm.
like a minimum bill requirement, which is not allowed, but
Mhm.
nobody checks them on it, except for us. And then
Enter
we
$1 for.
yeah, so we try and make those right, but there's some wild requirements out there. That's why I think it's important. Obviously, the screener tool is helpful, but if you are working with patients in a specific area, I would
Mhm.
encourage people to like dig into their own hospital's policy,
Got
um,
it.
and just kind of figure out like what are the things that they're going to ask you for. What are the income documents that they're going to ask you for? Are they going to require you to give 3 months of bank statements and pay stubs and this and that?
Mhm.
Like, what are the things? So that is all like really frustrating when it comes down to, yeah, all of
Mhm.
them are different.
So if someone puts in client information into the eligibility screener or does that with a mom in our program and it's coming up as not eligible, what would you encourage them to do? Like check out their own policies if possible, but is there a way that they could talk to somebody on your team to figure out
Yeah,
why?
absolutely. So there is also a option here. I believe I just need to. Oh, I think if I would have clicked like, oh yeah, I want full service or I want
Mhm.
self advocacy, then it would say, hey, do you want to schedule a call with a patient advocate? So
Got
we
it.
have hundreds of volunteers that will hop on a phone call with you. They'll fill it out for you over the phone because that's another thing. Is like access to computers,
Mm.
smartphones, internet. All of that can be questionable. So it's like we want to provide people the opportunity to just call a patient advocate and say, hey, here's my information, and then we would fill it out with you
Mhm.
over the phone or look into the policy. But yeah, figure out why it's saying you're ineligible, and then go from there. So yeah, if that happens, and then you can also just
Mhm.
email support at dollarfor.org or get on our contact page and somebody will reach out to for sure.
Great. And this isn't affected by whether or not a client has healthcare insurance, like whether they are uninsured or insured. Does that make a difference in the eligibility?
It does. It depends, because again, every hospital is different. So some
Okay.
hospitals will say, if you have any type of commercial insurance at all, you're not eligible for financial assistance.
Mm,
Again, I don't think that that's legal.
hmm
Hospitals do it all the time.
hmm
So we fight back on all of those.
Okay.
We don't think that, because if you have insurance, but your deductible is $6,000, like what on earth? So
hmm
like we don't think that having insurance is something that should disqualify you.
hmm
And we usually fight back on those and get approvals. Like it's usually a little bit more time, because you have to go through like the whole, okay, I got denied, and then you have to write a hardship letter, and you have to like have several conversations with the hospital.
hmm
But we typically fight back on behalf of the patient for pretty much all reasons that hospitals deny, unless the patient just is clearly over the income limits. Like if they, then
Yeah.
there's nothing you can really do. But insurance, that's kind of a bogus reason, especially if it's like, okay, I have insurance, but I still have an enormous bill. Like then,
Right.
well, like that's why charity care should exist. Like it's still a large out of pocket expense that you can't afford.
Got it. Okay, a lot to take in. Two more questions for you, Jared, and then we're gonna jump into questions just about that process. If you're working with someone, if you have your own personal questions, just wanted to open it up before we close out for you guys to have that option. Again, you can drop them into the chat if right now, even if you as you think of them. What are you most passionate about when it comes to educating and sharing about the work that you do?
That's a hard question, Shar. Thank you. I think that it's like, to me, I see. To me, it's like make it known, make
hmm
this known for people, and then obviously make it accessible. I get really, really fired up when someone uh, does something that they think is like the responsible thing to do. I mentioned like putting
hmm
it on a credit card, because you get this bill and a lot of times people panic and they're like, I am
hmm
going to lose, my house. I'm gonna, like, they start going down, um it's very overwhelming. So then they
hmm
think, okay, I just need to get this bill to go away. Here, I'm going to put it on this credit card. There is like almost no turning back there,
Yeah.
because it's like the hospital is paid, and people think it's like you would much rather have hospital debt than credit card debt, because
Mm.
like the hospitals, there's so many different things, but that people just don't know. So one, just in the last few months, the CFPB put out a report on medical debt, and after that came out, the all the credit bureaus got on board to not report any medical debt on your credit for a year. So
Wow.
your credit will not be impacted by a medical bill for a year after your first bill. It used to be 6 months, and then it would start to show up on your credit. Now it's a year.
hmm
Um, the other thing is, paid medical bills will not will be removed from your credit. So if you have a medical bill and it is, destroying your credit, if you paid that prior to to these new laws, it would still be impacting your credit. Like it wouldn't just recover. But now, if the medical bill is paid, your credit goes up to it's like
Mm.
completely restored. So there's a
It,
lot of different things that are helpful. So like I get passionate about like those little things that people do that are like, yeah, it's just like the education of it.
yeah. And the cascading effects, because I think a lot of the clients and moms that we serve won't put it on a credit card, but they just won't pay it. And then it goes into collections, and then it just, yeah, has these cascading effects on their lives and what they can put their name to and invest into the future, all because you trace it back to an ER visit that she had with her daughter. And
Mhm.
so, and to your point, and I think what you're so passionate about is just like calling that injustice and being in the space of correcting it and making, reforming that space. So what's one piece of advice you would leave to our community of advocates as we work with moms who may be going through a medical crisis or their children going through a medical crisis?
I think, well, first thing is just to be aware of these programs and share them. But I think the biggest thing is just the shame that comes with debt in
Mm,
general. People seem to think um, it's like they keep it a secret. They don't want to share it because there's a lot of shame in that.
yeah.
When you realize how many Americans are struggling with this, and that there is absolutely nothing to be ashamed about. It's like this is an
Yeah.
unavoidable debt. Nobody is choosing uh, a medical crisis. Like this is
Mhm.
something that so many Americans deal with, and that's like, yeah, I think it's that shame that causes people to put it on a credit card. Like, oh, I need to pay this. I
Yeah.
owe this, and it's like um, that right there is just like helping patients realize that um, that even though it's like it's even frustrating too because like the whole even the name charity care, it's like you're a charity case or something. Like people
Right.
get in this zone of like, oh, that's not for me, or I don't want that to be for me, or
Mhm.
whatnot. And it's just like yeah, try and get out of that headspace.
Mhm.
Like there's so many people that struggle with this, and there shouldn't be any shame involved.
Yeah. That's good, Jared. Thank you for sharing. We have a few questions we'll jump into. We'll start at the top. Do you see any healthcare reform happening in the near future?
No.
Depends.
I mean, I think that the more that I get in, the more that I get into this, I guess maybe a little more like discouraged I get around like just overall system change. I
Mm,
think that $4 is focused on um, policy change at the hospital level. I
yeah.
believe that we can go to a hospital and say, these policies that you have in place are unjust and they are doing this, this, and this to your communities. And I believe that we can get a hospital to change either through like name and shame or
Mm,
social pressure, all these different things. Um, and I think that that can have some pretty big impact. But as far as like overall healthcare
mm.
reform, I will not hold my breath.
You're not optimistic. Okay.
Yeah.
At what point can someone begin the process? Do they have to wait to receive the bill? Or when they know that they are going to have a procedure, can they be proactive and begin the process before the procedure?
Yeah, great question. So most of the time people will come to us after they receive treatment and have a bill. You can do this beforehand. So think of charity care as a status. You
Hmm.
have, you have been approved for charity care. When you get approved, you're usually in your like approval letter, it will say you've been approved for charity care. This is a one-time thing. That's not true.
Hmm.
And it will also, you can apply for charity care as many times as you want.
Okay.
There is absolutely no limit. There is not, and don't think of charity care as like a pool of money that the hospital has to give away. And then at a certain point, like, oh, we're near the end of the year and it's dried up.
Mm.
Absolutely not. Like there is no limit to charity care. We have gotten $30 medical bills waived. We've gotten $500,000 medical bills waived. Like
Hmm.
there's no limit. You can apply as many times as you want. When you get approved, it'll say you're approved for 6 months or
Mm.
3 months or sometimes it's even up to a year. Any treatment that you receive in that 6 months or whatever the approval, it will be covered under financial assistance. After the 6 months or whatever the approval time is, once it's gone, you can apply again. It's just that they
Mm.
want to see new proof of income and updated financial documents. So um, you can apply for financial assistance before you have your procedure or whatever. If you get approved that status, then when you go in for the procedure or whatever you have, it will be covered under financial assistance.
Got it.
So you can absolutely do it beforehand. Most people don't do that
Hmm.
because most of the time you're applying for something that's like an ER visit,
Hmm.
ER visit or something that happened that is like you don't have time to plan for.
Hmm.
But you can do that.
This is a probably really dumb question. It's my question is maternity care, because obviously we're with moms. So all of
Yeah.
them at some point are in a hospital having a baby. Does that fall under the same umbrella
Yeah, so we have gotten it's a super common uh,
request?
reason people apply. We've
Okay.
probably gotten millions of dollars in maternity services covered. So yeah, shouldn't be an issue. We this is like a total side note, but just
Hmm.
to give you a little more context of sometimes how like ridiculous these hospitals can be. There's
Hmm.
a hospital in Maryland that is actually sending letters to patients that we've applied for that says your financial assistance application has been denied because maternity services are considered elective. So it's
What?
such a bizarre, like, that's not legal.
Not good.
The hospital doesn't have that in their policy. It's just that that's what they're communicating to patients. And so, anyways, that was one of the ones like we fought back. We
Mm.
mailed them a few nicely worded letters, and they retrained their staff. They changed their policy. Like they're not denying women for maternity services. Now we are trying to
Oh, that's awesome.
back and like how many mothers were impacted by this, and we
Hmm.
need to refund them, do up. So we're still working with them on that. But
Hmm.
just an example. But that is the only time I've ever seen that. Most
Mm.
of the time it's covered, no problem.
Jeez, that's crazy. Okay. I lost my place. Beverly said you are allowed to make payments to the hospital. This is not a question. You are allowed to make payments to the hospital as low as $5 a month, as long as you continue the payments. Or you affirm that, Jared? That's true.
Yeah. So payment plans can be super low. I would encourage people. Sometimes people in the hospitals kind of make it seem this way. It's like, oh, once you start a payment plan, you've entered into this contract of like you're going to pay
Mm.
this bill, and now you're not eligible for financial assistance. That is absolutely not true.
Oh,
If
really?
you are on a payment plan and you've been on a payment plan with a hospital, and then you discover I'm eligible for charity care, the hospital should waive your entire bill. They should also refund any amount that you have paid on that bill. So
Wow.
don't just fight for the financial assistance, get that money. Like I have
Mm.
gotten huge swings for patients where it's like not only did they get their, few $1,000 medical bills paid, they got a check for whatever they had paid in the past. Because if that bill is eligible for financial assistance, no payment should have been made. And it's on the
Mm.
hospital to vet you for that. And if they didn't, then they owe you money. So definitely fight for that. And we do that as well.
That was Kristen's question, which is a good follow-up. Can someone be ineligible based on the date of their bill? Like it's been too long. Is there an expiration date that it has to
Yeah.
be within a certain
So
amount of time?
yeah, the number that you want to keep in mind is 240 days. That is the federal minimum. So the time that you receive your first bill, the clock starts ticking. You have 240 days to apply for financial assistance.
Okay.
There are some states, California, Oregon, Washington,
Mhm.
Colorado, that have extended that to be sometimes years or no limit at all. But most states and most hospitals will give you the 240 days.
Mhm.
One other note, hospitals will send you to collections after 120 days of no payment.
Mhm.
So you can be eligible for, you can be in collections and still be eligible for financial assistance. Most of the time, people think I'm in collections, game over.
Mhm.
That is not the case at all. The hospital normally will either own or have contracted work with that debt collector. They can pull that debt out of collections just as easy as they put it in. So it's like
Mhm.
if you are within 240 days, no matter what, you are eligible for financial, or you are within the time frame, whether it's in collections or not.
Got it. Because Beverly asked that too. How far back can you go? Jared just answered that. Leonte says, what resources are being used to promote this more? There are so many families in child welfare systems who could benefit from this, but may not be aware that this opportunity exists. This is amazing.
Yeah, that's what we're trying to figure out.
He's like,
Uh, it
share
is
on all your
not,
social media.
yeah. I mean, it's really frustrating because it's like I'd like to be able to direct people to like I'm constantly plugging $4 because one, I believe we're the only organization that is advocating for patients to do this.
Hmm.
So that's frustrating. The other thing is, you know, you can't count on hospitals to get this out, or so it really it's just like from what I can tell, it
Hmm.
is our social media. It is. I
Hmm.
mean, there are articles being written about hospitals like lack of charity care, but
Yeah.
even those like they don't really get into. Hey, if you're like here's how you can get this, or here's how you can access. Um, it's really frustrating. So yeah, help us get the word out.
We will.
What I would say.
Kristen says, what options are available to applicants if they get denied?
So there's always an appeal process. You can always appeal. We do it all the time. So classic example would be, you know, hey, I had a job that paid me well, and I lost that job, or I'm on medical leave, or whatever it may be. So now my income has dropped significantly. But if you are looking at my past income or my last year's tax return, it shows that I make like too much money,
Mm-hmm.
but I don't. Like my circumstances have changed. So at
Mm.
that point, we would encourage you, and we have templates for this, and we will even write these for you. Is a hardship letter. So just explaining this is my situation. We have gotten so many applications reversed just by writing
Mm-hmm.
letters to these hospitals and saying, "Hey, we got denied. Here's a little more information on what's going on." Or I yeah, was making this money. I was just diagnosed with X, and my income is going to be impacted because I'm unable to work, or whatever. So
Got
it's really
it.
important to always ask, how do you appeal? And then at that point, we even have, and I don't advertise this a ton, but we do have a lab program that we are helping people negotiate medical bills. So if you are
Mm.
not eligible for financial assistance, we actually have patient advocates and an attorney that will hop on a phone call with you and the collector and try to negotiate it down. Um,
That's amazing.
so there's a whole bunch of other things that I could suggest on that. Payment plan at the lowest possible amount,
Hmm.
like somebody mentioned up there. Yeah, $5 a month, whatever is that you can afford, just so that it doesn't go to collections or impact your credit.
Hmm.
Um, that would be another option, but we would try to get it waived before
Yeah.
committing the payment.
And after this, we will follow up with a recap for all of you guys of just a one pager, any resources that Jared recommends regarding these questions. We'll take one more and then we will wrap. What if you've paid for a large portion of the bill already, but then hit a financial crisis, such as job termination, funeral expenses? Can you still be eligible even if a large portion of the bill has already been paid?
Yes.
Like if you began that process. Okay.
Yeah. So anytime that your financial situation has changed, you can reapply. And
Okay.
they will tell you that. Like, even if you've been denied, if a month later you lose your job or something like that and reapply and write that letter, you
Hmm.
should be approved. They're going to go off of your current financial situation. And yeah, even if you've paid, now you might not be able to get that one refunded because at the time that you made the payment, your income might have been higher. But as far as like a readjustment of the bill, if your financial situation has changed, then you're fine.
Okay. And then last one about medical bills what about medical bills that come in the mail after attending a doctor's visit? So have you guys had any success outside of hospitals that you've
Uh,
begun to dabble in?
yeah, so here is the kind of like general rule. Financial assistance, the hospitals have to have it, nonprofit hospitals. So any of the providers within the hospital um, usually are subject to the same policy. So imaging, surgeon,
Hmm.
anesthesiologist, radiology, like all of these bills that come in after your hospital bill, once you get approved through the hospital, you can forward that letter to all the other providers and they should honor it at the same level.
Mm.
So some of them might have their own process. So I would just like, and again, this is like, it's just so annoying how much time um, and like what you have to know. But yeah, I would call every single one of those providers and say, hey, I've just applied for financial assistance through the hospital. Can you please put this bill on hold while
Mm.
I get my um, determination for charity care? And then you can usually get those to be waived through that. Sometimes they'll have their own programs. You have to fill out additional paperwork. But if it happens within the hospital, um, you should be good. If you
Mhm.
are sent outside to labs or any type of physical therapy, chiropractic, whatever, not so much.
Mhm.
Those are going to be all privately owned. They're not going to have any type of assistance program. So this is going to be hospitals and services that are received within the hospital.
Got it. Okay, you guys check out dollar4.org. Is that right? Okay, dollarfor.org. Again, we will send a recap of some of these main points just boiled down for you guys and some resources that can be made available, but we'll get you all the links that you need. Check out his Instagram, TikTok, DollarFor, share their stuff, get the word out. Use this service for the moms that we serve every day and their kids. This is not a rare crisis. This is a national crisis, and it's made available to you guys. Final
Also,
words?
about printable things, I believe that we are sending these to EMA. So this is going to have a specific link QR code that goes right to our screener. So you should have those soon. And
Yes.
if you want these, we can send them your way.
Yep. We'll send those to you guys, and then we'll get you that link so you guys can have it and have easy access to it. All right, Jared, thank you so much for joining us. This was really informative, great resource, great tool, so much knowledge and just passion around this issue. So thanks for taking the time to teach us about this. And to everybody that joined, appreciate you on all you do. We will see you guys next month.
Thanks, everybody.